I'm Dr. Melissa Gilliam. I am an associate professor in the Department of Obstetrics and Gynecology. I am chief of family planning and I'm head of pediatrics and adolescent gynecology. I run a research program where we combine research, policy, education, and clinical care to inform our research. And most of my research looks at unintended pregnancy with a particular interest in adolescents and adolescents' risk behaviors associated with sexually transmitted infections and pregnancy. I had the idea to start a new center at the University of Chicago in about 2009. I started looking at the capacity at the university to conduct research in women and children, and I felt as if there was an under-tapped resource to really affect change in some of the most important problems affecting women and children around the world. The name of the center is the Center for Reproductive Biology, Health, and Behavior. When I look at many of the problems that affect women, it has to do with their inability to control both their bodies and their reproduction. And so if you go from that stream, you start to see that if you can't control your reproduction and the timing of your reproduction, then that's why we have so many unintended and unplanned pregnancies. That's why we have such high rates of maternal mortality. If you look at the major causes of maternal mortality across the world, it has to do with postpartum hemorrhage, infection, and unsafe abortion. And this causes many deaths, in particular in sub-Saharan Africa, India, and South America. So for me, much of it is a lens of family planning. But I think we have to look even broader and look at reproductive health in general. There are a number of interesting frameworks. One is sexual health, where you start to think about issues that either have to do with the reproductive health across the life course. And so we have to think about the risk that people have in their daily behaviors, whether it has to do with sexually transmitted infection, unintended pregnancy, violence. And so for me, the exact issue is less important than that we think about it in this broad capacity, that we think about the individual from a biologic level all the way out to a behavioral and social political level. And then once we have that framework, then we start to put together teams of people who can really affect change in those areas, whether it's violence against women, unintended pregnancy, early childhood diseases, preterm delivery, adolescent risk behavior. I think all of those problems become fair game once you have this framework in place.
I attended a symposium last fall, and that's where I really got more involved with the center. But Melissa and I really started working probably about 4 or 5 years ago in a working group, really trying to sort of understand from interdisciplinary perspectives this whole notion of sexual risk-taking and teenage pregnancy among adolescents. But I think that relationship sort of moved and was further cemented by the symposium last year. I think very often, like most universities, we tend to be siloed in our departments or schools. But it was really an impressive attendance of more than 100 researchers from across the campus who were really looking at sexual risk-taking from different disciplinary perspectives. So for me, it was an eye-opening experience and was also an opportunity to develop relationships with some of these colleagues.
The challenge in creating the center has been going from an idea that you have in your head to something that's a reality in the real world. That's been where I've had the opportunity to work with Arate, which is an organization, the name I believe means excellence in everything. But that's been an opportunity to incubate this idea and to really put some actual steps in place to make this a reality.
So I'm hoping that this center would have a major impact on the south side of Chicago. So when we look at where there are high pockets of STD infection, HIV infection, well, it's all around the south side. The university is at the epicenter of where STDs, HIV is, particularly among communities of color. So one, I hope that we are relevant to our community on the south side in terms of with shared partnerships really make an impact in terms of reducing the rates of HIV infections. In addition to that, I hope that the center would bring increased visibility to the great work that's going on here at the university and also help to move the field nationally in terms of bringing together biology, neurology, social work, medicine, psychology, to really look at some of these ongoing pressing issues that are affecting young people. So increase visibility nationally, increase impact locally, and also help us to raise the visibility of the university nationally as well as internationally.
I think the University of Chicago has a number of opportunities to change the landscape of this field and make it a unique center. First of all, the university has a tremendous capacity to conduct interdisciplinary research. Some of it has to do with the fact that it's a relatively small campus and you can walk from one end to the other and meet exciting and engaged people in a very simple and easy way. But the second is that people are excited and are willing to work in an interdisciplinary way. And so one of the delights in even just starting this process has been creating a network of colleagues who can be from very diverse fields but are willing to engage on these topics. As a result, I think we have this tremendous ability to start with a problem and say, this is a problem that has multiple dimensions, and so we may need an economist at the table, we may need a PhD in sociology at the table, we may need a person with expertise in health studies, a person who is conducting biological research. And at a place like the university, we can bring these people together at the same table. And so partially it is the framework. I think in general we've tended to think about these issues in a very narrow way, but increasingly people are, both inside of the university and outside, are thinking about broader ways. And I think the university brings these types of ideas to the fore perfectly because we're so willing to engage and be adventuresome and think about disciplines that aren't our own.